Are you or is someone you know affected by complex mental illness? There's a 1 in 5 chance, if you're in Australia, that you just said yes. But if you said no, I'm here to tell you, there is someone in your life right now living and managing their complex mental illness to a point that they do not need to disclose to you that it's even going on. I am one of the incredibly fortunate people who has access to treatment and support so that a rich, meaningful, fulfilling life is something that I can now expect rather than have no hope of ever experiencing. Because I can assure you, for years, I did not believe the kind of life that I live now or the way that I feel about my day was even possible. And I know that I'm one of the very fortunate few. When people get diagnosed with a complex mental illness, they or their family or their loved ones not only have to deal with the symptoms of that illness, thankfully many symptoms are treatable, but also the stigma, which includes self-stigma, which was definitely the case for me and a huge reason as to why I didn't get help as quickly as I needed it. Thankfully, really, truly powerful charities exist to help people who are stuck between needing help and getting help. Because it might seem like a simple step, but I'm here to tell you, it's a mighty chasm when you're finally faced with it. One of those charities, in fact, the oldest charity doing this kind of work in Australia, is SANE Australia. For 3 years, I very proudly sat on the board at SANE Australia under the previous CEO. And while I'm no longer a director there, I am an ambassador for SANE Australia. And today you're going to hear from one of the most inspiring women you'll likely ever meet. She's the CEO of SANE, Rachel Green. She's a mother of 3. She has a long and celebrated career in policy, particularly as a part of the National Mental Health Commission. She's done work at Black Dog Institute's Lifespan Project, and she's been the CEO of Independent Community Living Australia. Fair to say she's got runs on the board in this space. She's an absolute weapon, someone I cannot wait for you to meet. Enjoy this chat with Rachel Green. I'm happy that you're here today. How do you do today, Rachel? You okay?
Yeah, I'm doing pretty well. I've just come from the preschool Mother's Day morning tea. It's like cake and little tiny chairs and fizzy drink. Yeah, it's a nice way to start the day.
Delightful. That'll give you an idea of when we were recording this. We won't release it too far after recording, but it's nice to have those moments. That is the good thing about having kids in daycare and kids in school. As a father, they generally start coming home with the Mother's Day things about 2 weeks out.
Get a good little reminder.
And you go, oh, fuck, yeah, that's right. Yeah. But, you know, when I was a teenager or whatever, or, you know, in my 20s, like, what do you mean? Why are we going to lunch with Mum on Sunday? Like, I just saw her. Like, oh, that thing.
Yeah, absolutely.
We are associated with the same charity, SANE Australia. I used to be on the board at SANE Australia under the previous CEO, Jack, and you came pretty much just after I left. And I am now an ambassador? I think that's my role.
I think so.
Yeah, an ambassador for
an
SANE.
all-star.
Well, I don't know about that, but I'm really grateful to, you know, the number of years that I spent on the board at SANE. It was my first board role, and I'm on another board now, which is nice. But it really opened my eyes to not only how governance works, how corporate governance work, how non-profit governance work. Gave me a real squeegee my eye open with this is how slow policy change happens when people don't want to change policy, like how when you're trying to convince people. And it also really opened my eye to the numbers of people in Australia that are dealing with complex mental illness. You've had a long career in not only policy but also government departments and a lot of non-profits. What was it about coming to SANE that was the move for you? Because at the time you could have gone anywhere. You know, what was it about going to SANE that was like, yes, that's why I'm going. That's why I'm going.
Yeah, it's a great question. You know, I was a hard no on SANE right up until I signed the contract. When I was first approached about the role, I was running a small Sydney-based disability housing mental health provider. And it was my first CEO gig, and I'd done kind of just over 2.5 years of really hard yakka through the pandemic in the eastern suburbs of Sydney. So where the first outbreak happened, like there were days we were driving from pharmacy to pharmacy trying to buy individual masks for staff. And I'd renovated all these houses. We'd gotten 40 houses like flipped over. People were in better homes. We'd set up new services. And I was just hitting this point of I've got trust and buy-in. I'm 30 minutes from home. This job has become manageable. I've done the big turnover. I definitely don't want to change roles. And I got approached about SANE and, just kind of went on the journey, thought it would be interesting to learn about where SANE was going. And at each step of the interview process, actually, they had Egon Zehnder, who are, it turns out, very globally well-known recruitment firm, but I hadn't heard of them. I said to my husband, this people with a funny name. And they would ask me, the woman who was doing the recruitment would ask me about myself and just kept catching me on days when I was in a bit of a truth-telling mode. And so I'd do these big downloads about my past history in my life and my lived experience and what drives me. And I would walk away thinking, gee, well, they're definitely not going to consider me with everything I've shared about everything I've done. And, but it started to pique my interest. But really, it was a newspaper article. I was down in Canberra visiting my mum, and there was a headline that said, I guess a trigger warning to listeners, it said, body found by the river, may have been there for 6 months. And I read it and thought, that'll be one of us, that'll be someone from our community. And the picture next to it was this good-looking young guy, like good-looking. The guy would have maybe 10 years ago sidled up to at a party, and his story was every story. I read through to the coronial report and how he just had this sort of, classic, fairly rapid progression from age 17 to not able to stay in work, struggling with his mental health. He hits the mental health system. It doesn't respond very well. It doesn't help his family. He's not eligible for the NDIS. And then he ends up dying just by sort of misadventure. And I read it and I thought, gosh, that you look at that timeline and the system is coming in here right at the very end with this big gun intervention like the NDIS that he's not even yet eligible for. And that point of intervention where we could have made change was 12, 15, 17.
Wow.
And the whole system is backwards. And I thought, you think about the cancers where if you get a big cancer, we throw everything at you. We throw, chemo and surgery, with the exception of some where you don't do that. But generally it's go in hard, make change, be comprehensive. And the mental health system is completely the reverse of that. It says, if you get a bit worse, you might eventually be eligible for a bit more help. And it's the most backwards thing that you could possibly do. And it was that, once that happened, once I read that story, I couldn't put it down because I started to formulate in my mind from a bunch of other roles where I'd done systems work. Well, what if we did do a comprehensive approach? What would it look like? And how would you track it? And how would you manage it? And the idea, it's like a virus. I couldn't put it down. And then sort of against my will, I was like, okay, I guess I'm changing jobs now and I'm going to go and do this thing.
Well, look, we could do a whole hour on unpacking what you just said, which I think is really well worth it as far as, if we wanted to, but we'll see where it goes, about just changing the paradigm of how we treat mental health. If we treated cancer, now stop me if I've got this wrong, I just want to get it back to you. If we treated cancer the way we treated mental health, yesterday I went to my GP, I'm going to hold up, you won't see anything, but I've got that many referrals and things because I'm like a classic dumb Australian man. I've gone for one thing, anything else, and I've said 7 things, because about 6 months. Why didn't you come 6 months ago? Anyway, one of the things is, you're going to go to see a dermatologist about that.
Yeah.
So there's a thing, all right? There's a thing on my body. I grew up in Queensland. There's a thing on my body. And she goes, it looks like a bit of a BCC. We'll better sort that out. Now, if I go up to the dermatologist and they lop it off me and they biopsy it and they go, we can see some mutations. That's starting to metastasize. Oh, yeah. If it gets any worse, you might be eligible for some further treatment. Off you pop. Try and get a good walk in. Try and, don't drink and use so much. And, have you listened to this podcast about CBT, cognitive behavioral therapy? Off you go. And we would expect that people didn't die.
Yeah.
It would be fucking ridiculous.
Yeah. Just try not to have cancer. Just
try not. So this is, I have got that right. So this is essentially the way that our public health system is approaching mental health. And I'm sure there are reasons why. And, it has, gone to the most the fire department goes to the most on fire house versus, the little fire. They go to the one that's really out of control. So that in itself is absolutely bananas that the early, and I certainly saw this on my time on the board, that the money, and it's sorry to be capitalist about it, but when you're dealing with the public health system, the money spent for a critical intervention that might involve hospitalization and housing and such, it's hundreds of thousands of dollars, versus when the person, maybe 20 years prior, when some signal shows up, a smidgen of that could offset things. Now, this is not hyperbole, right, Rachel?
No, and it's particularly relevant around the social stuff. So, there is a clinical element to which in therapeutic or clinical terms, you definitely don't want to over-treat. That could cause harm to someone if they had an issue that's this big and you had them suddenly doing massive amounts of clinical treatment. That there is a sensible test there.
We don't go straight to electroshock therapy. No.
We don't. But in the functional sense,
which is very useful and it works a lot.
Yeah.
It just also works a lot for screenwriters who want to put something scary on the screen. But let me tell you, I've sat in the chair, my hands jumped around doing it. It's okay.
In the functional sense, though, that earlier, more intense intervention can play a big role. So if you just imagine, even someone with no mental health issues needs to build functional skills, particularly through their teenage years. They need to learn how to make a plan and see it through. They need to know how to get a job, how to work out how to get information on managing their taxes. Schools don't teach all of that. And so particularly if you've grown up in a family environment where you haven't seen good role modeling or there just hasn't been much exposure to good functional skills, those are the things that are at risk if you get a mental health issue. So functional intervention, more time spent learning how to work your way through a task. Life's a bit of a mess, broken up with your girlfriend, can't clean your house, all these bills are due, can't quite work out how to manage the money. Those are all sort of standard daily living functional problems. So investing in that, I think, pays dividends kind of no matter who you are, and particularly for people with mental health issues. Investing in that early will prevent functional loss later on, and particularly if you invest not just in the individual but also the people that are around them, because these things interplay in a household. It sort of stands to reason that if you've got one person with poor functional skills, there's probably other people who would do with some support, and vice versa. If you've got one person who's really, really struggling and everyone else is trying to maintain function, going to work, going to school, making meals, cleaning up after yourself, the impact of someone who's really struggling on the rest of the household can be significant. But that doesn't exist. The thing I'm describing, that certainly the skill sets exist, like social work, occupational therapy, daily living support, they're all programs and work types. But there's nothing right now. If you're a family and you've got a 15-year-old or an 8-year-old or a 17-year-old or a 24-year-old who's starting to show that, there are challenges there, you can't kind of request that. You can't go to your GP and say, can you sign me up for some intensive family functional psychosocial support? It may be available in 20, 30 years' time if everything declines enough that you make it into either the acute system or the NDIS system. And it's just bonkers because the benefits of it could be so powerful.
Now, there are people listening who might be just going, what do you mean complete a task? What do you mean, clean your house? What do you mean, do the dishes? And I guess in the same way that when I tell people I'm an alcoholic and they say, well, just don't have a drink, I'm like, yes, that makes perfect sense. You're thinking that with your brain. You got to understand. Like what you just described, there was a time, and it was right before I got caught, unbelievably, luckily, got caught by the public health system up in Brisbane. There was a time when those things I was completely incapable of doing. It would be toast for days at a time because the very idea of trying to put rice on was too much. I couldn't do it. I would freeze. I wasn't able to do it. I didn't know how to deal with anything that wasn't just simply right in front of me. And it was, and I got really, really lucky because they caught me right at a point when that was going to start to turn a bit of a corner, I think. But this is a thing that people may not understand, that their brains are different, and some brains and some families just don't have those kind of skills that many other people take for granted. And so it's very difficult if you're making judgments on them with your background and your family structure and your skill set. It's why can't you do that? I can do that. Surely you can just do that.
Yeah, absolutely. And I think that's where, stigma breeds. But really what we're talking about is neurodiversity, and, right across the full spectrum of every type of, neurodiversity and sort of cognitive ability, people will have different skill sets and different strengths. I mean, I can I feel pretty comfortable in the strategy space and in the vision space, cannot pack a bag to, like, you should see me if I have to do work travel. There's a lot of sitting down. There's occasionally some crying, because trying to think it through and overthink it, and each sort of decision, getting stuck on that, and then it turns into, actually there's 50 other things I want to think about. My brain's going over there. It's a classic ADHD problem, but and that can be writ large across your life, especially if you build in, depression, where not only are you struggling with the sort of cognitive load, but that willingness, that motivation is gone. I actually think it's something that we're going to see. It's going to be more of a factor for more people, I think, because living in modern society is becoming increasingly, the cognitive load's going up. It's not get up at 5 a.m., go out and work in the field, come back. It's manage complex interactions, complex systems and reminders and follow-ups and things you've got to do, whether you're working or parenting or trying to study. That load on the
more
brain.
data and more data and more input than we have ever had before. Our ancestors created agriculture and brilliantly figured out how to make surplus, and so we were no longer just eating the things we walked past. We were able to grow things and therefore have a bit of time on our hands. But that's pretty much where our brains and bodies stopped developing. Physically, we are exactly the same as we were a couple 100,000 years ago. Nothing has changed. And so our brains are only at that capacity of, like, this is about as much as we can think about. Yeah. And yet, I'm recording this and it's 10 to noon on a Wednesday morning. I reckon today alone I have ingested more written words, visuals, pictures, recorded sound than someone even 50 years ago would have to fucking sit down and take a week off. The amount of data that I have input into my body since I got up this morning. Yeah. And that in itself is something that is not going to get smaller, and it's something we need to be mindful of, that our brain does have. There's a limit to how much we get. The spinny beach ball if you're on a Mac, or a blue screen if you're on Windows. We get the spinny beach ball.
Yep.
We start working.
Yeah, absolutely. I read a thread this morning on Twitter talking about OpenAI and ChatGPT, and it was someone saying they'd observed that of all of the, everyone's using it, everyone's testing it. The thing that people seem to be doing the most is getting it to do writing for them, because they were sort of speculating that people hate writing even more than they hate doing maths. And so they were talking about, it turned into this discussion about, right now, we get all these public health messages, we've got to go to the gym because our daily life doesn't involve as much activity as it used to. Are we looking at a future of mind gyms? We have to go and deliberately read things and write things because it's been removed from your daily life, which I thought was quite interesting. And are we likely to have the same attitude to going to the mind gym and reading the Quick Brown Fox as we do to going to the gym?
Maybe. I often make that analogy. It's like you don't accidentally keep a six-pack throughout the year. It takes a lot of effort and a lot of work, and you've got to think about it all the time. So similarly, you don't accidentally have good mental health, especially if you've been through an episode like I certainly have. If you've lived through times of very, poor mental health, it takes work to stay on the good side of that every day. And that's okay. It's a part of my day, but it doesn't happen accidentally. I just want to go back for a second though, because I know I started going to see psychiatrists when I was like 5. Sometimes these things show up and they eventually grow up into your 20s to be depression. Sometimes they become anxiety, and both of those things mostly are treatable. 1 in 3 people who have depression are non-responsive to treatment. What kind of things with the daily living stuff that we were talking about before, like something that eventually shows up as schizophrenia or something, which in young men often happens in 20s. Well, how would those things make that life be a little better if you started to put those interventions in earlier? Yeah,
I think it's a great question. I mean, one of the things I love doing, I love being able to do at SANE, is talk to the many people who are ambassadors and board members who actually live with schizophrenia and hear them talk about how they manage it and where intervention's been helpful for them. And I guess to understand it, if you're not familiar with schizophrenia, it's a condition where people experience what are called positive and negative symptoms, which don't mean good and bad. Positive meaning a thing is happening, and negative meaning a thing has gone away. So the positive symptoms can be experiences of auditory, visual, hallucinations and beliefs. And the negative symptoms is sort of loss of affect, loss of motivation and things like that. And so for some people, it's a combination of therapies and medication. For some people, it's functional stuff. One thing I've always found, that I've heard quite consistently from people living with schizophrenia, it's the support system around them, and also what, our good friend Janet Ma would call contributing life, like feeling like you're doing something valuable. I think also that a big part of intervening early is avoiding the loss of functional skills, so staying connected. And it's interesting because there's probably some parallels with what we're being told about dementia, and how hearing loss can impact that. So later in life, if your hearing starts to go, you'll be having less conversations and doing less listening, and that can exacerbate a tendency towards dementia. And it sort of plays out, can play out similarly for complex mental health issues, particularly something like schizophrenia, because if let's say you're hearing things, you're seeing things, you're experiencing the world quite differently, that can be quite frightening. For some people, particularly younger people, that might mean they're turning to drugs and alcohol to cope with that. And so what's happening is they're starting to present differently in the world. They're withdrawing from it. And the more that withdrawing happens, the less they're practicing and engaging and just keeping those functional skills going. So a really early intervention would be about regular social interaction and people who are going to play that role of coach or buddy or peer worker or support person or counsellor, and a mix of those, and working with family members on how to provide that support whilst also helping someone continue to feel independent. Like it's a fairly complex sort of thing to get right, and it needs to be tailored to the individual person, but it's absolutely, it's all within reach. That's, I think, what frustrates me at times, which I spend a lot of my time driven by rage. It's not rocket science. And it ends up, like you said earlier, like, no, let's get capitalist about it. It comes down to dollars and cents. Like, have we put the dollars in the right place to pay for the people who do those jobs to go and do them in the right place at the right time? And the answer is still no. I always get stuck on that, the IT say, have you tried turning it off and on again? And every time I see a budget announcement, I think, have you tried funding it properly? Because what you'll never hear is there were 100 people who had a need and we funded all 100 of them to get the thing. There's a lot of bamboozling you with 1 million, 200 million, 1 billion. But anytime you see those figures, just divide it by the number of people who are living with whatever that thing is. We know there's at least 650,000 Australians with complex mental health issues, and then times that by about 4 or 5 around them, the family and friends. We're talking about 5 million people.
There's two things I'd like to talk about there. It's probably helpful if we do. The difference between complex mental health issues and not being mentally well. Everything's on a spectrum. Day becomes night. It's never fully daytime. It's never fully nighttime, right? So everyone's brain's on a spectrum, and it can vary throughout the day. But on the complex level, let's talk about numbers for a sec, because I think this is kind of important to talk about. In Australia, what are the numbers? You mentioned 650,000 Australians live with complex mental health issues. Now, this is people who live day to day and manage these things as a part of their daily life. How does that compare to the people that, they go through a breakup, they lose a boyfriend or girlfriend, they lose a job, they lose a child, they have a period of depression or anxiety or mental unwellness, but then they get better. What are the numbers like compared to that? And what's the of the really, really, really sick people who end up not being able to actually be out in society? What kind of numbers are we talking about?
Yeah, look, relative to people who experience sort of any type of general mental health issue, on any given year, it's 1 in 5. So, super common to be experiencing poor mental health, and possibly higher than that. One of the things that happens as, we continue to do more awareness campaigns and talk about mental health, as more people start to reveal it and talk about it. And I think we've certainly, seen signs of that happening during the pandemic. At the complex end, and complex is a tricky term for us. I mean, we use it because it is a point of difference at saying, one of my bugbears is there's a lot of funding and a lot of organisations that work in the more sort of mild to moderate end, and then just draw a line for people who have ongoing mental illnesses. And sometimes I find that the messages around that, particularly in the workplace mental health space, can be really othering. There's a lot of keep the well people well, and the subtext is keep the mad people out. But at the more complex end, where you might have an ongoing diagnosed mental health issue or set of mental health issues, or mental health issues and other things like drug and alcohol issues, family violence, we don't actually know the exact numbers. And I think that to me is still quite a shocking fact. So there was a national survey in 2007. I'm going to go data nerd for a second. You've got to let me, because it's my thing, it's my special special thing. 2007 national survey, and tied to that was a thing called the SHIP, the Survey of High Impact Psychosis. And it counted people by finding them in the hospital system who were living with things like schizophrenia, schizoaffective disorder, borderline personality. And over the decades since, we've redone the national survey, and then we just left off complex. So we don't actually know right now how many people in Australia are impacted by high impact psychosis or complex mental health issues. And I think that's quite shocking. It's just one of those things that fell off the policy agenda in the intervening years. And so it means that we're undercounted. And that flows on. Then just coming back to your point earlier about seeing the insides of how the sausage gets made from a policy and an advocacy point of view. Categorically, services aren't being planned based on accurate numbers. So are we funding it properly? No. And that's one of the things that I'm really hoping to be able to change, and it's why we focus so heavily on data and digital at SANE.
And that's like, to draw an analogue to that, it would be, we do a census to count how many kids there are and where they are so we can build schools in the right places. I live in a part of the city where one of the high schools got closed because there wasn't high school kids living nearby anymore. They're trying to reopen it because it turns out that we do need it. But, there are schools that used to be pumping and now they're not. It's just how suburbs change. It's fine. And now there's a school 3 Ks further west or east, depending on what side of the city you live on, that now it's just heaving. And so similarly, like, we wouldn't accept that with our education system. Why should we accept that with our health system? And understanding that the likelihood that anyone, including you, will deal with a mental health issue in sometime in your life, it's 50-50, isn't it?
It is, and I think it's often a real shock to people when they first interact with the system. I meet a lot of families and meet a lot of mums in particular, and the ones who are newer to, they're supporting a family member who's, begun to have or had escalating mental health issues, and the sort of disbelief, shock and anger that they share consistently at how can it be like this? How can it be that they just sent us away with a note saying, sorry, we won't see you, don't forget to go see a GP? How can it be that no one called us back? How can it be that the doctors don't talk to each other? How can it be that there's no service in my region? You talk about something like eating disorders. Maybe about 10 years ago, there was some announcement. There was a figure, $4 million. Doubling of the number of eating disorder specialist beds, and the doubling of the number was that it went from like 2 to 4. I was like, cool. How many people need the beds, just out of curiosity? Like, is someone going to ask that question? And so for people who are just having their first interaction with it, it's a huge shock. And I guess the reason I talk about the data is hoping to at least kind of explain to people why that is. How can that be? Well, it's because we're not actually counting us yet. There's a sort of an adage of saying what gets measured gets done. And that's where the data can be really powerful, is standing up and being counted and saying, actually, forget the labels. We all matter here. That's where the new tagline for SANE comes from. We're people like you, because literally we're people like you means you're welcome here, but it also means we're people like you, damn it, and we deserve all of the same things. We deserve the same access to healthcare. It should be like any other condition.
As a former board member, I'm extraordinarily happy that tagline happened, because the thing is that SANE is one of, if not the oldest mental health charity in Australia. I think the acronym originally was Schizophrenia, a national emergency, which, even just saying the word schizophrenia, we've said it about 4 times now, people have probably got some flashes in their brains about what that means.
People see that image. They see the guy on the bus with his missing teeth and he's talking funny. And it's like, no, like, come and meet the families. It's someone's brother. It's that baby that you love that just grew up and then, had some challenges and needed help. It's husbands and it's mums.
Yeah. I, as you just mentioned, I had the absolute joy and privilege to sit next to, at those board meetings, somebody who was managing life and living an extraordinary life with schizophrenia and managing their schizophrenia. To say that I work in an office with people and some of those people have schizophrenia, people would, pun intended, lose their minds.
It's still shocking.
It's still shocking to people. But, what's the difference between someone who's, well managed? What's a life with schizophrenia like?
It's a really live topic for me, how we talk about mental health issues in a way that both recognises how difficult life can be, particularly if you haven't got the support around you, but also don't present only sort of tales of woe, because that just decimates the hope that people might be having. I mean, one of the other things you asked about taking on this job, I read this tile, a social media tile from a SANE peer ambassador, with a quote saying that, you know, when he was 17, he was told he'd never have a job and never go anywhere in life. And I read it and I went and I thought, and I looked him up on LinkedIn and I said, me too. Because a psychiatrist told my mum sometime when I was about, I don't know, 12, 13, 14, that, you know, she needed to manage her expectations for me. It was unlikely I'd ever get married or have a job, and she just needed to really be prepared for that. Of course, my mum didn't tell me. My aunt told me after you know, like a sort of a late night staying up chatting one time.
Have you found that doctor and gone, CEO, motherfucker, and 3 kids?
No, but I did tell that story at my wedding, and I was like, so look at me now, also hot husband. So
Yeah, well,
that was a big moment for me. But it's tricky because it can be extraordinarily hard. Like psychosis can mean people believe and respond to things that are not the reality that everyone else is seeing, and that might mean they believe things about people they love that aren't true, and so you can end up in a whole world of really complex stuff around, you know, someone is saying I'm being persecuted, all these things are happening, and so then the system might try and wrap around that person and take them away from their family, and you've got to balance this line, particularly for service providers, of what's true and how do we support everyone and be inclusive. It's really, really complicated, and it can be devastating for families. And I think it's really important that we just present a balanced and real picture and not tell shiny stories. And one of the things that drives me pretty up the wall these days is the kind of coolifying of ADHD. So if I had it before, it was cool, but now it's like the Silicon Valley CEO thinks like, oh, I've got ADHD and I've got an app and everything's fine. I'm like, well, yeah, but it is sometimes really struggle, and actually it's not that easy coping with sensory overwhelm when you've got kids and they make a lot of noise and they want things, and there's all these inputs and there's, you know, 50,000 other inputs coming from work brain, and actually trying to get those to, like, I find that really difficult on a daily basis. And 15-year-old me would watch this and think, screw you, you know, as if you get what it's like. So yeah, it's a tricky thing to talk about. And I suppose the thing we try and do at SANE to resolve that is tell a lot of stories and a real mix to sort of present a real picture, but also, you know, push back on that hopelessness vibe, because doctors shouldn't be saying that stuff to families.
Well, I guess, look, at the time, to have some sort of empathy to the doctor, perhaps at the time that were the only outcomes that doctor had seen and was trying to be as kind as they possibly could be, whereas we know that's simply not the case. It's simply not the case. You are gratefully an anomaly, but there's probably 3 other kids they saw that day who went, and their parents went, okay. I pitched a doc on ADHD. I heard a story about, someone whose child got diagnosed at, 9 or 10, and they basically went, it's fine. I'll just throw him in TAFE and he can be a tradie. It's like, how dare you? How dare you decide this kid's outcomes in life? How dare you give up on that kid? No, not at all. So it is, you know, I understand where that stigma around that kind of stuff, but you can't be what you can't see, Rachel. And if that's the only thing that people have seen, then that's why would they expect anything else? Because they don't understand, and it's fine. But it's the education part around that. But just to go back to the schizophrenia thing for just a second, like the idea that at a workplace like SANE, completely okay to say, schizophrenia, that one, like completely fine to look at an office and go, this person. Yeah, when you look at the stats, when you look at the numbers, the amount of people that are managing these kind of brains, I don't want to call it mental illness. This is what your brain does. It's nobody's fault. It just happens, all right? In our society is so colossal that there's every chance your workplace too there's people who are, you know, going through their lives, managing and having a wonderful life, contributing and getting joy and love and having great families and great careers at the same time as these things that are often used in screenwriting or in some other kind of popular culture, or certainly in our language, as the scapegoat of all odd human behavior.
Yeah. I remember I worked some years ago for an organisation which will remain nameless, and I came in quite sort of wide-eyed, and I was really excited about, you know, bringing some lived experience concepts in. And I said, let's do a survey, and we'll find out how many people have lived experience or have experience as a family member or carer. And we did the survey, and the stats were kind of what you'd expect. It produced about 1 in 5 had a lived experience, but the carer figure was off the charts compared to national data. It probably reflects the industry. You see a lot of people in caring roles go and become mental health professionals. And then I sat down with the person who was running HR, and I said, this is great. This means we can really start to talk about how that lived experience is valuable, and maybe we could even look at position descriptions and job ads and talk about, lived experience being a positive attribute or desirable. And they said, we don't want that. We don't want these people working here. I thought, I hate to break it to you. We don't want people with mental health issues. And I'm like, yeah, sorry. And I was at a conference recently, Corporate Mental Health Australia, and there's a lot of great stuff about, trying to support well-being and policies and procedures and leave and things. But the message, I think, still across most workplaces is please stay well. And yeah, the subtext of that is please don't be unwell. Please don't come in. So we're not yet anywhere near the adjustment we need to be on workplaces and inclusion to where it'll feel like, you could get a job and then mention during the onboarding process, by the way, I have borderline personality disorder. These are the adjustments I need. When I have performance meetings, it's helpful for me if they're like this or like that. Or, I have schizophrenia and I take antipsychotics. That means in the mornings aren't good for me because they tend to make you quite groggy. Those conversations are still not ones that I think anyone is ready to have. Workplaces, either well-intentioned, will overreact, or employees won't feel safe to disclose. So, the vision on the horizon, I think, is inclusion and accessibility and adjustment and really normalizing that stuff. I don't know if you know the brand Heaps Normal, but it's an alcohol-free beer. I love what they've done with branding no alcohol drinking as normal. It's Heaps Normal, and I'm a huge fan. I keep hoping that they'll pick us for a partnership, but we need the same thing for mental health, particularly in a workplace context. That it's just not even a big deal anymore. That would be the vision for me.
I couldn't agree with you more. For when I speak about brains and different brains on stage, when I get sometimes I do corporate stuff, I go at pains to point out that different brains and brains that are diverse in their thinking make connections that other brains don't, and they come up with extraordinary ideas, and they're incredibly valuable. And some of the greatest breakthroughs we've ever had in our community, in our society, have been from brains that there's evidence to show are neurodiverse or have other things going on. They're not neurotypical. And so to value those things and understand that to have those brains in your workplace is actually quite an advantage.
Yeah. Yeah. And resilience too. Like through the pandemic, hey, there's a big scary thing. It's really unknown and you're going to be stuck at home looking at a computer screen. A lot of people with lived experience went, cool, we'll be right. We're used to coping with a fair amount of stress and worry and pressure and adversity and isolation. So and they just carried on.
I had one moment, but I did kind of double down on everything else.
Yeah.
I already had the strategies. I just turned the volume up on the other strategies,
Yeah, compared to people who are like, no, I need to, I'm social and I'm out there and I go out every night. It was a huge shock to them to suddenly be frightened and under pressure and the unknown and stuck at home. So that, the diversity lens is absolutely the right one. And there's a lot of, research on that in all different settings. If you look at boards and governance, diversity of thinking it leads to better decisions. It leads to better management, and it applies at every level. When we actually launched the new brand for SANE, which I don't know if you can see the T-shirt. I've got the T-shirt on.
Oh, lovely.
We're going to get you a T-shirt.
I'll be in one later today.
You'll be in one later today.
We're filming a thing later this afternoon.
And we got some support from OO Media to put billboards in shopping centres, and we were doing the creative, working through it. People come up with cool, we'll support you kind of taglines. And I said, what if we just wrote schizophrenia and see how people react? And everyone kind of thought, there was this sort of reaction of, oh, is that going to bother people? And so we did it. And the billboard said, we get schizophrenia. And it was a play on the tagline where people like you, where it had that double meaning of, we get it, you're cool here, but also people get it. And one of the moments that I loved was, quite a few of our staff with the new T-shirts on went and took selfies next to the billboard. So they stood in a public place wearing a T-shirt that says SANE next to a glowing blue billboard that said schizophrenia, and then they posted it on social media. And that I think is really symbolic of the change we're hoping to make as an organisation. It's it's that heaps normal effect. We're okay to stand next to this, to stand by it, and that's been a really exciting moment.
And as you have seen with a career in policy, just because something's a great idea doesn't mean that it's going to happen. Immediately. Political will and public sentiment. It's turning a cruise ship. You got to go. You can't go too fast, otherwise people's drinks will spill. You slowly. You got to get people there. You got to get people around. And I understand why we have these ideas about complex mental illness because if someone who is untreated and has been untreated and in an awfully terrifying, horrible state commits an act of violence, that is a very shiny news story, a very loud news story. And, then you can go and speak to the neighbors and go, yeah, he was fucking weird. You can get all that. But the likelihood of that actually happening is infinitesimal. I'm not saying it doesn't happen, but it's infinitesimal.
So many of those stories too are often really misleading. Like you'll hear, they're often presented as if it's causal. There's a mental health issue present and that's why this thing happened. And actually what is often happening as well is toxic kind of attitudes to women and domestic violence. And those might be co-occurring, completely unrelated to mental health issues, but the headlines get presented as, it's that news media tries to go with, are they bad or mad? And the impact that has on people who are living with something, they're not going to go and tell their colleagues. They're not going to go and seek help or want that to be written down somewhere on a record about them. Has a really powerful negative effect against help seeking when that stuff hits the media, and it's terribly sad. And as you say, the statistics and the data, just so clearly show you are far more likely to be a victim of violence if you have mental health issues. In fact, the suicide risk for people with some of the more complex and ongoing conditions is about 10 times higher than the general population. Yet suicide prevention, when it's funded and when it happens, is almost never about people with complex mental health issues, people who experience what we might call chronic suicidality. In fact, all of the best sort of training and evidence and programs out there are all about the opposite of that, the one-off impulsive. And those can be effective, but they don't actually work for chronic suicidality. So again, it's this othering of, we can do workplace mental health, not for you. We do suicide prevention, not for you. And that, I suppose, is, it's a big driver of what we're trying to change here at SANE. So actually, we're not going to be quiet in the corner anymore. We want you're going to start to design this stuff with us.
And as you mentioned, this is somebody's brother, son, dad, mum, grandma, teacher, accountant, friend, boss, colleague. This is who we are. It cannot be understated the impact of something like Are You OK Day or Movember around creating the conversation and opening up the conversation around a one-off impulsive act of suicidality will take someone's father, mother, son, daughter away just as much. All right. So it's by no means saying that is any less worthy. Yet it is safer for us to look that direction and say, are you okay? Because I can ask you, I could probably have a conversation with you, but I'm afraid to ask if you're okay.
Yeah. Because the people who are not okay a lot of the time, they don't get asked.
Yeah. And I don't know if it's what you're describing, the chronic suicidality, but I remember there being like maybe a year and a half of feeling like that every day. It's 20 times a day.
And nobody talks about it. I mean, I have lived with that myself for years, and it's not the kind of thing where, and it's sort of, it might cycle up and down a bit, but it's always there. And it's not the kind of thing people are like, are you okay? Oh, no, actually, this is what I'm thinking about right now. Because you're going to get this intense reaction that's going to be, in all likelihood, traumatizing and not helpful at all. And so people keep it to themselves. And the system doesn't know how to respond. It only knows how to send you to the ED. That's the end. That's the end of stage of all the training programs and interventions that are out there is check if they're suicidal, be comfortable. That's a good message for your listeners. If you're worried about someone, you can safely say, hey, Osher, are you feeling suicidal? And you can answer the question. And people will most likely, even if they are feeling suicidal, they'll feel relieved. They'll be like, oh yeah, yes, actually, I'd like
And
to
they'll
talk about
answer you
it.
truthfully.
Yeah.
I can state that. I have asked that question to people myself. Sounds like a confronting question to ask, but it is the most relieving question you can be asked when you're in that state. They'll answer you truthfully.
Yeah, the next step in all those programs is then, great, get them to the ED. And the ED is just not, it's not
Emergency
set up.
department, we're talking like.
It's not set up for that. And
No.
most likely you'll get sent home again with a note to go and see a GP, and that's where the whole system falls down.
I was lucky enough to make a documentary with the people at Loon Media. We made a documentary for SBS about suicide prevention. And Toby Ralph, the extraordinary cameraman, he made Fight for Planet A and War and Waste. Like, he's an extraordinary cameraman, beautiful guy, really sweet man. Made all the Todd Sampson stuff. Like, he's the man you want with you when the shit's going down. He's an incredible guy. And we were at this extraordinary place just across the road from Blacktown Hospital. It's a suburban house, because just even getting into hospital is such an overwhelming thing. The intake process is so overwhelming, people won't do it. This is just a suburban house. They had a kitchen, they make you a cup of tea, they sit you down, they ask what's going on, and then, can take you through that process and essentially then walk you across the road. And Toby, as we were walking away, packing up the caravan, he said, hospitals only have a blood and guts door.
Yeah.
They don't have
That's great.
You're not blood and guts, but you're just as much of an emergency. Okay, so this room that's full of very bright lights and people literally bleeding from their head who will be seen well before you, and they'll keep walking in, so you'll probably have to sit there for 5 hours. This room's not for you. There's a room around the corner for you. It's far nicer, way less intense, and we'll be able to take care of you here. Yeah. And I was like, he thinks a lot, this guy, but it's not rocket surgery. You know, it seems to be such a simple, and it's never simple when you say that, certainly when it comes to policy and health policy. But it seems like it's such a demarcation between this person's in no less danger, but you can't just then send them home.
Yeah, and there are great emerging designs for those, and there's been some good investment. I had the privilege of being able to set up a couple of them during the pandemic, and as challenging as it was trying to do anything during that period, when I got to read the outcomes and the sort of findings from the qualitative interviews, and every in a previous role I set up a suicide prevention and recovery cottage where people just got to come and stay for 4 or 5 days. And there wasn't a lot of premise to it. It was just a nice house with comfy beds and some people you could talk to. And people called it life-changing because it was just a place to go where you felt safe, and it was a bit of a break from your day-to-day. It was clean. You could have some conversations, do a bit of journaling and go home again. And they called it life-changing. And for all of the challenges of doing it, reading that is so powerful. I guess where we try and play a role in that now from SANE's perspective, because we're a digital org, is just a different piece of that puzzle, because there is some growth in the policy and investment in what are called either safe spaces or overnight stay or what are called prevention and recovery centres in Victoria. The piece missing for me is still no one is checking whether you got there or not. And so that's the role we try to play as an organisation. We call it our Bridging the Gap strategy. And so because we're digital, we're all about applying what is essentially retail technology. So the analogy I like to use is shoe shopping. You go online and you find a pair of shoes. You're like, should I buy them? You're like, maybe I shouldn't spend that much money on shoes. And you don't buy them and you walk away. But
your cart still has the Louboutins in them.
Yeah, you're going to get an email the next day, retro green, maybe you do want these boots. Did you forget? How about an extra discount? We really miss you. And the messaging is all very come back. You're a valued customer. And the health system doesn't do that at all. We're using more technology in online shoe shopping than we are in mental health and follow-up. So that's literally...
I've got a 90-day trial and a CRM that I could give them an offer code for.
Yeah.
It gives me a year free.
Yeah. Yeah. So that's literally what we're doing now. So we've designed the way we work completely differently. We've designed it around the person so that everyone who has, who's a participant in our kind of digital community in eligible regions gets I think of it like a passport, but it's a place to make a plan, and you can make a plan with our peer workers and counsellors, and you can add in information from your GP, and if you go to a hospital you can update it there. And we're working on the sort of technical connections so that we can apply almost like a contact tracing QR code methodology, so that wherever someone shows up in the system, I want to see a ping on the system so that we can ring up and go, hey, Osher, we saw that you were in the hospital this weekend. How you doing? Did you get a next step? Where are you meant to go? And you'll say, I got told to go and see my GP. I'm like, cool. Do you have a GP? Have you booked that in? I think that is a really critical role that no one's played yet, and that's what that's what brings me to work every day. I'm so excited about it. We're still building all the bits of it, but that's kind of the vision.
That's extraordinary, and what a great idea, and what a great implementation of technology is, hacking our brains to act on impulse and do things that we might, no, maybe not, but then, okay, I will.
Yeah.
It's just really very, very clever. You've got young kids. I've got, an older teenager and a young kid. What's your message for parents? What's your message for parents of children if they're worried their child might grow up and develop a complex, their beautiful cherubic-like child may one day be diagnosed with a complex mental illness versus you should manage her expectations? What would your message be instead?
That's such an important question, and I'm going to really try not to get too emotional about it. I mean, I'd love to say, do this or do that, or here's what's out there for you. But the true answer is I'm working on it as fast as I can. We don't do enough to support parents who are in that position of thinking something's happening or something's happened. Like you can't always prevent a trauma from occurring. And when that happens to your 6-year-old kid and suddenly they're talking about suicide and you can't get help, like there's no more real situation. And it's tricky for me becoming a parent and knowing what I know, knowing how life can turn out, particularly for boys, that they're at this much higher risk of suicide rates if they struggle, particularly in their teens and 20s. You're sort of watching it all unfold, and we don't have good systems of support. And one of the things that we're going to build, but we're still working on, is that sort of network between parents and carers to sort of share ideas. But I would say your GP is probably still your most consistent form of support, and it's worth spending the time if you can and the dollars if you can to find one that does get to know your family, because they are the navigators of the system more than any other health profession. They're this sort of spidey knowledge of if we do this and if we do that package and we can come here, we can go there and you can get that. So I would say lean into that GP relationship. It's probably your best bet in trying things, and then when they don't work, going back and trying something else. But it is really hard, and I think that's what that might be where people's minds change. Like if you grow up not knowing much about mental health and you have that, that guy on the bus stigma idea, and then you become a parent and you think, what if something happened to my kid? What if my kid was someone with mental health issues? That really changes the dynamic, I think, for everyone when they hit that stride. Also because parenting is really, really hard.
Yeah, it is.
It's really
but that's
hard.
Okay.
You don't know what you're doing, and
okay.
it's intense and it's amazing, and you don't want to stuff it up. And I suppose it enhances or focuses my lens on this stuff, because more and more I see that picture of, for all the young kids out there that are struggling, that are not, I talk with other mums about this, where they've got a kid in their family who's 8 years old and struggling and not accessing the NDIS, not eligible, but really, really struggling, and therefore the whole family's struggling, and they're spending $30,000 a year out of pocket on trying to get help, because they know where it can go, how it can lead to disengaging from school, disadvantage. So mental health is the most important thing. So be prepared to be flexible on the other stuff, like try different things, get help, get into sport. I'm a soccer mum now. I have no idea what's going on. Constantly just 5 minutes late to all the games and the training, and have to sort of find someone who knows about soccer and get them to explain to me what's happening. But, it's great social skills and, team building stuff for my son. So I'm there with the coffee at 8, 9, 10, 11 in the morning. But be prepared to try new things yourself as well, I would say.
And as far as expectations for your kid or your friends or, your relationship, if a diagnosis comes along?
Yeah, know that you can grow through it, and that life will throw at you the most random, different things. So even when you're in the pits of despair and worry, even when you're just so sure that it's bad, it's always been bad. I mean, high intellect goes with poor mental health, unfortunately. So you're in the pits of despair and you're pretty smart, and you're just so convinced that it's always going to be like this. One of the most powerful things a psychologist ever said to me was, if you're so good at predicting the future, Rachel Green, why don't you tell me the lottery numbers? And I was like, oh. And she sort of just it was just one of those moments. It's like, it's true, I can't actually predict the future. I mean, I'm pretty good at guessing where things might go. And that was at a point when I was sure that I was never going to find a relationship. I was going to be alone forever, and which is completely wrong. And that's the definition of anxiety, right? Is spending all your time worrying about things that probably won't happen, and the changes that do happen. And that applies to the hope, right? The good things that will happen. You can't possibly predict the amazing stuff that's 10 years down the track. And it might end up looking completely different, and be okay with that, but always hang on to that hope. There are so many people I've met who will tell that same story, that, the things they thought would happen versus where they ended up and what they're doing now. Sandy Jeffs, who's one of our SANE founders, OAM, and plays soccer and writes books and travels around and a keynote speaker. And that's not what she would have thought, or what her parents would have thought when she was first diagnosed with schizophrenia. So hang on to that hope and be prepared for all the good surprises as well.
What would you say to people who, and this is the trick that our brains play on us, that it's only happening to me, I'm the only person that deals with this. You don't know what it's like. No one knows what it's like to look after someone who's dealing with this.
Oh, yeah, totally. I was that person. I always have this idea about one day doing a talk and finding one of the photos of me with dreadlocks and, torn clothes and periods, just you wouldn't have picked it. You wouldn't have known. I used to talk to Janet Meyer, our patron, about this, because at the time when I was particularly when things were really bad as a teenager, I would see, some of the people who were sort of celebrities who would talk about mental health, and I'd be like, yeah, right, as if you probably have assistants and someone cleans your house and everyone does anything for you. And I was, struggling to string two baked beans together and, struggling socially. And you wouldn't have picked me back then. So I would say if you're, feeling like you're the only one going through it, you kind of can't tell people that it's different to the reality that they experience. But I would say just keep trying and hold on and breathe through it. And as much as possible, try and connect with other people who are like you and have conversations. We're a place for that. You can talk to us on SANE. The forums are there 24/7. And hands down, there'll be someone on there that actually is a lot like you. And I can't kind of overstate how powerful that is when you connect with someone else and actually have that shared experience.
Being able to speak to another person, I can explain what paranoid delusions are like. I can explain what even less than that. I can try to explain to someone what alcoholism's like and what that's like, and they'll be like, oh yeah. But if I sit down there and I look at another one of my mates from the Super Secret Sober Club, within 2 sentences, they're like, yeah, I gotcha. Yeah. And instantly I feel like, there you go. I see you, you see me, we're here.
Yeah.
And it is kind of interesting. It's a trick our brain plays on us that we're the only one going through this and no one, it's never going to get any better. It's never going to change. Like the actual fact, and I can tell this, because it's proven, no mental state is a permanent state. And every problem that you have has already been solved by somebody else.
Yeah.
All right. And just you find the right combinations that are particular to you, all the solutions are there. And there's no way I would be alive right now, Rachel, had I not had a team of people who went, this way, mate, this way. Come on. Okay. Oh, mate. Okay. You fell back a bit there. This way, buddy. And trusting those people, for me, that was a pathway out. I know I was very lucky in that I got to get out of that space. I still have I'm in a management phase and I will be for the rest of my life. That's fine. I understand that not everyone gets to be out of where I was, but life can be so much better by understanding you're not by yourself, you're not alone. Other people are just like you, connecting with people who are just like you, and understanding that, you know what, other people's ideas might actually serve me here. I might see I might try something else. And that's the other thing you said, which I really hit upon. Someone asked me this the other day. People ask me about, their kids now. They used to ask about their friends, now ask about their kids. And I said, I think I lost count at 6 different versions of medication combinations. I stopped counting after 6, but I just had to keep trying. I could not be with the idea that this is what it was going to be like. And I was very grateful that I had a psychiatrist who was like, okay, let's try something else. And it took a while. It took years to get it right. But I just kept going, kept trying. I'm still trying. We just did a new adjustment just the other day.
Yeah. That's such an important message for you to be sharing, because people think of it like, oh, I have the what's the thing you're allowed antibiotics for? I can never remember. Yeah, I have this condition. I'll get an antibiotic. It'll be better. You'll know the right one. You'll give it to me. I'll take it. Bing, bang, boom. Mental health is not like that. And I sometimes think of it as a charm bracelet. Like, I've collected a few diagnoses over the years. Maybe eventually I'll collect some more. But the what works for it, you have to try different things and adjust. And if the person you're seeing, like if you're going along to see someone years and years and you don't know why you're going, you don't feel like it's getting any better, well, like, you can change.
Yeah.
You can try someone else. You can ask them. You can go along and say, hey, I'd really like to know, what sort of therapies do you practice? And are they indicated for my condition? And when will I expect to see some benefit? And what will that benefit look like? And you might find that health professionals are a bit shocked by that. They're not really used to self-advocating consumers. But all of that stuff you can do, and also know that you'll change too. You will age. You will grow. And therefore what you need might change. And sometimes in really positive ways. There can be effect, particularly with some of the most complex mental health issues, where things do just hit a point over a certain age, if you can make it that long, where what you need is quite different, and different stages of life. Like, there's something about hitting your 40s and you just care less about the small stuff.
Really?
Just come in. It's just what it is.
And having, if you are lucky, if you're if you choose to, and if kids do come into your life, whether they be step kids or other, that brings its own set of joys and challenges, and something you thought you might have gotten past, now something else shows up. You're like, oh, crikey.
Yeah.
All right, back to work. Better get back in there, because now something else is showing. And that's fine. That's life. That's what it is. This is the thing that I really loved about when I first got asked to join and be a part of SANE. It was the idea that skilling people up, and even just what we just talked about advocating for yourself, understanding that you are valuable and worthy, and here's some ways that you can speak to your people who are treating you about your outcomes. And it's not to say that, like, I am not a mental health professional. Nor do I claim to be one.
Yes, we need a disclaimer at the bottom.
Paid for the ski holidays of many, but I am not one yet. And I don't think I'm smarter than them, but I know when our work together isn't getting either of us any further down the track, and I'm able to go, I need a bit more out of this, but it seems like we've done 3 or 4, months here, and I'm not breaking through anywhere. I would like to see if something else can work.
Well, and even if you don't know, you're a person and you have a right to ask questions.
This is true.
You're important.
Who'd thought? That took me a while to get to that, trust me. But the other thing I do love about SANE is, as we mentioned before, is connecting you with other people who are of a similar, kind of band on that spectrum, and have similar experiences, and make just the feeling of being less alone is so important. And being able to then see people who were where you were and are somewhere you might like to be one day is absolutely vital. Yeah. Because when I'm in that state, I don't know. I can't tell. I'm in hopelessness. I'm like, it's never going to be any different. And it is, as you mentioned before, is connecting with people. And that's one of the things I really love about what SANE does, is it is that community of people who come together to understand that is extraordinarily helpful, was helpful for them, and they want to give it to somebody else. And that's just a beautiful thing. Yeah, our forum members are amazing. There's something like almost 40,000 people on the SANE forums. It's 24/7. You can start your own gardening club. You can talk about what you're experiencing. You can ask people for help. You can just share how you're feeling. They're a remarkable community, and it's a real honour and a privilege to be a part of it. I'm so grateful you found your place there, and I'm grateful as well. I'm not going to lie that sometimes you're driven by rage, because sometimes it's a useful motivator. That's the punk rock musician bit of me. It's just so you still want to like get out of the guitar and turn up the distortion and break the system down. So I think that's it's a bit that lives on. I am here for the punk rock generation ascending to positions of power. I am all for it. Generation X is in charge. You are all about it. Have a fantastic day, Rachel. Thank you so much for your time today. Thanks, Osher. It was so great to speak with you.